If your brain is like mashed potatoes at this stage, this poster is for you. I promise to give you the shortest version I can of the current study, and feel free to contact me at any point of the conference or later or before to discuss any details you want. So this is the famous piece of art of René Magritte. If you're not familiar with, you might want to Google it. This is a representation of a pipe, mikteret in Hebrew, and the word mikteret as a root morpheme with meaning related to smoke, a template mi'et, which is a feminine tool, and they are intertwined together to form the word mikteret. And this root KTR can be efficiently used to derive many different words, such as, listen carefully, מקטרת, קטורת להקטיר, הקטירה, קטרנה, קטיר, הקטירה, תוקטרנה, תקטיר, הקטירו, יקטרו, and so on and so forth. All these words share the same root, therefore they share morphological, phonological, orthographical, and semantic information. So it turned out that Igbo speakers are very sensitive to the root morpheme from a very young age because it carries the core meaning of the word and it is central to lexical access. Also, there are evidence for distinct processing of the root morpheme in the brain in specific regions. So we wanted to increase the sensitivity and awareness to the root morpheme among patients with aphasia because we thought it can facilitate word retrieval. And also currently there aren't any Hebrew-based naming therapies in Hebrew or other therapies, so we wanted to fill this clinical gap. Also, we wanted to explore whether treatment-related changes will involve regions that are associated with processing the root morpheme in Hebrew. So the treatment has 3 steps. The first one was explicit instruction to increase morphological awareness of participants and to the relatedness between different words sharing the same root. The second step was to identify morphological relations by identifying words that share the same root. And the third step was naming to a morphological cue during sentence completion task. So there was a sentence with a word that was related by root to the target word, and participants had to complete the sentence, and by completing the sentence, they actually named the target word. So we had 12 participants with aphasia with a post-stroke aphasia in the chronic stage, and the stimuli were 60 morphologically complex words, i.e. words with root and template morphemes. So all participants underwent screening tests. Those that were included in the current study, the 12, also underwent 3 consecutive naming tests of the morphological complex words I've just mentioned. These words were divided into 30 treated items, 30 untreated items based on success in naming, length, and frequency. After that, participants received 20 treatment sessions. Following the treatment, they underwent again naming tests, and there was a follow-up meeting to assess improvement and maintenance 10 weeks following the treatment. So what are the results? The x-axis is the timeline, the y is accuracy. If we look at the treated items, most participants improved from pre to post-treatment, 11 out of 12, and all of them maintain these improvements in the follow-up assessment, 10 weeks following the treatment. This is nice, but many studies have shown improvement in treated items. So if we look at the untreated items, we see generalization among 6 participants who improved from pre to post-treatment in naming untreated items, and 3 of them maintained this improvement in a follow-up assessment. I'm short in time, so I'm not going to go over the imaging results, but they are very interesting. I just want to stress the point that we made in the current study, that we think it's very important to take into consideration the characteristic of specific language being treated when developing language therapies or treating patients with aphasia. Although we know that the brain, that the language network in the brain is similar across different languages, but there are still distinct characteristics of each language in the brain and in behavioral studies that we should take into consideration. Thank you for listening. Thank all the participants in the study, and I wish we'll have the chance to further discuss about the current study. Enjoy the conference. Bye.